Democrats are ready to make healthcare the center of attention again. As the threat of a government shutdown looms and the midterm elections approach in about a year, Democratic lawmakers are eager to dive into a significant debate over healthcare. Historically, the Democrats have successfully campaigned on healthcare issues, and they perceive that a government shutdown would amplify their narrative as they aim to dismantle the Republican dominance in Washington. For several weeks now, members of the Democratic Party have been vocal about their intention to link the extension of enhanced tax credits under the Affordable Care Act, ACA, commonly known as ObamaCare, to the government funding discussions. What's at stake here is a clever political strategy. If the Republicans choose not to cooperate, leading to a government shutdown, the Democrats believe they can pin the blame on their rivals. Conversely, if they succeed in securing a deal for the tax credits without triggering a shutdown, they will claim that as a victory too. As one insider noted, they can sort of have the best of both worlds. They can aim to satisfy their party base now while securing a significant win for their constituents through the ACA tax credits. And in doing so, keep healthcare at the forefront of public conversation. This will help them attract undecided voters leading into the midterms. The Trump administration has played a crucial role in keeping healthcare at the forefront of discussions. The approach to public health issues, including vaccinations and controversial directives like the recent guidelines on painkillers for pregnant women, has stirred significant public interest. With the base of the Democratic Party urging their leaders to take a stand against the Trump administration and GOP lawmakers, Democrats view healthcare as an apt issue for a high-stakes confrontation. Brad Woodhouse, a seasoned Democratic strategist and president of the advocacy organization Protect Our Care, reflected on the situation, stating, "We've demanded this. We've fought for it. We believe that if a battle must be fought, it should be over healthcare issues." He praised key figures like Senator Chuck Schumer of NY and House Minority Leader Hakeem Jeffries of NY for firmly establishing a clear stance on this matter, which he believes is the right move. However, the clock is ticking. As no actions are taken, the enhanced tax credits, which were introduced during the COVID-19 pandemic to ensure coverage affordability, will lapse at the close of a year. According to research by the KFF Health Policy Group, if these credits do expire, average premiums for individuals enrolled in the ACA could skyrocket by more than 75%. In previous instances, Congress has extended these enhanced subsidies on 2 separate occasions. Nevertheless, with Republicans now in control of the government, many conservative members seem content with allowing these credits to expire. Democrats are adamant that any short-term funding legislation must include extending these crucial subsidies. Though GOP leaders seem receptive to the idea of extending some form of the tax credits, potentially with reforms attached, they assert these discussions can wait until later in the year, either November or December. Senate Majority Leader John Thune, our state, articulated this sentiment during an interview with CNN's Dana Bash, stating, "This is a program that requires reform, but I believe everyone is open to discussing how we can improve it in an appropriate context, not as a bargaining chip to keep the government operational." Nonetheless, insurers are currently setting their rates, and the open enrollment period for ACA plans is set to commence on November 1st. Many individuals are already receiving alarming notifications regarding significant rate increases. If Congress delays action until the end of the year, most participants of healthcare.gov will have already chosen their plans, potentially leading to disastrous financial consequences for many. As per the Congressional Budget Office, if any reformation is initiated after September 30th, it could result in cost savings for the federal government. However, individuals would not benefit from lower premiums. In the face of this challenge, Democratic strategists express that if Republicans remain inflexible, a government shutdown could fortify the Democrats' position further and heighten the attention on healthcare debates that they seek to engage in with their Republican counterparts. In the event that the Democrats manage to bring Republicans to the negotiation table and secure an extension of the enhanced tax credits, numerous other healthcare topics present vulnerabilities for the GOP. Woodhouse pointed out, unless the Republicans completely reverse course by restoring Medicaid cuts or reinforcing the Affordable Care Act through these tax credits, they are going to find that healthcare emerges as a significant issue next year, and it will cost them dearly. While there hadn't been any calls for Health and Human Services Secretary Robert F. Kennedy Jr. to resign among Republicans, some have started to voice concerns regarding his actions on vaccines. Public comments from President Trump have also led to a strong backlash, particularly when he recently advised women to stop using Tylenol during pregnancy, encouraging them to tough it out instead. During a recent media briefing, Senate Minority Leader Chuck Schumer, Dem from New York, underscored broader Democratic concerns, highlighting the substantial, nearly $1 trillion cuts to Medicaid that financed Trump's signature tax reform legislation. It's not solely about the ACA tax credits, asserted Schumer. The cuts to Medicaid in the contentious legislation are shutting down rural hospitals and clinics, reducing long-term care facilities, leading to job losses, damaging local economies, and ultimately leaving entire communities without necessary medical care. Polls indicate that voters tend to trust Democrats more on health care compared to any other issue. A recent memo from the center-left think tank Third Way urged the party to capitalize on this momentum. Democrats ought to make healthcare costs their unequivocal focal point, the memo suggested. They should be unwilling to engage in any bipartisan discussions on government funding unless the Republicans tackle the healthcare cost crisis they have largely contributed to. Darbin Wofford, Third Way's Deputy Director of Healthcare, emphasized the significance of healthcare as a relatable issue. Should the tax credits expire and the Medicaid cuts take effect, both patients and healthcare providers will feel the repercussions long into next November. Wofford cautioned, "What do you think? Will the Democrats successfully leverage healthcare as a key issue in the upcoming elections, or do Republicans have the upper hand in this debate?" Share your thoughts in the comments below. Copyright 2025 Nexstar Media Inc. All rights reserved. This material may not be published, broadcast, rewritten, or redistributed.